if we can't do another transfer until 2025, I want to make sure that we're doing our due diligence when it comes to my fibroids and when it comes to my husband's semen analysis or semen quality. And the embryos that we made were made with his semen that was frozen when we know it wasn't a good quality. And our clinic, even though they do this is the one thing I'm like a bit frustrated with, even though they do this, they didn't offer or bring up to do a DNA sperm fragmentation test, which I saw somebody put in a Facebook group that is also at my clinic, that it's 100 euros. And then I'm like, oh my God, 100 euros for peace of mind would be useful. And so there's another girl that I saw on TikTok that had recommended Dr. Ramsey in London, and he works with more the male factor infertility side. And I've been looking at some of the videos he has on his website, and a lot of the things that he talks about with like his patients are like a lot of the things that I'm seeing in our particular situation. So number one, my husband has a varicocele. Number two, his semen analysis wasn't good. It has improved. I don't know if you know this, but like men's semen analysis can change every 90 days. And so in May of 2023, I think he got results back, and the UK NHS has deemed it as normal. But the one category that he still wasn't normal in was morphology, which if you have a varicocele is like not out, like the two go hand in hand basically. And so basically I've contacted Dr. Ramsey's office to see if I can get an appointment there, because from my understanding, they book a few months out. So if I'm gonna have to take time off and not be able to get over for a transfer until 2025 and won't be able to travel because my immigration status is processing, may as well see if we can get in with Dr. Ramsey. I've seen people who get a diet from him and they conceive naturally. I've seen people who did IVF, had embryos, none of those embryos took, and then have a procedure done with him. At least I'm pretty sure it's him, or maybe it's a procedure just that he recommends, and they get pregnant naturally. And so I just feel like if we potentially might have time off, we should look into these things. Now, if that's the case, say worst case scenario, my husband has to do a procedure, or even if we have to change our diet to what Dr. Ramsey suggests, that's then adding on another 3 months from when we actually get an appointment to see him. And from my understanding, he books about 3 months out. We're at the end of August, let's just call it September, October, November. And then you're on the diet plan for another 3 months. So that's December, January, February. That's 6 months. If I'm gonna take 6 months off just with that, maybe I should look into going and getting the rest of my fibroids removed, and then I would need a year-long recovery. I could potentially be 6 months into that. So that's kind of where my head is at with that. However, I'm like, we've got 4 embryos left. Maybe they're not the best quality, because this is another reason why I'm like thinking through like watching Dr. Ramsey's stuff that like there might be an issue, is that from my understanding, if you know otherwise, please correct me in the comments, but the egg quality, like you can kind of look at the egg quality and see if, you know, the eggs that were retrieved were mature, if they fertilized, and days 1 through 3 of like the embryo growing is like more based off of like the egg, whereas days 4 through 5 and 6 is more off of the sperm. Well, we didn't have a major drop off like after day 3, but we did have a drop off. So we retrieved 13 eggs from me, and 10 were mature, 10 fertilized, 10 made it to day 3, and then I think by day 5, I feel like 8 of them were still going, but 2 of them were like, they were slow going, so they were like, let's just get rid of those 2 and then we'll freeze 6. So I'm just a little bit concerned with the way that dropped off. That was a drop off impacted because of the semen sperm aspect of it. So I guess what I'm trying to say in the longest way is maybe we look at me having the rest of my fibroids taken out, but I need to look into the risk of that, because what if it causes so much scar tissue that then an embryo doesn't implant? But equally look at how we can potentially improve the sperm quality and maybe look at doing another retrieval once the sperm quality is improved, and then do getting out the fibroids. So I feel like I need to make this into one more part, so bear with me.